Welcome back, everybody. Listen, this morning we're back here at Buffalo Vascular Care, right on Transit Road in Lancaster, with Dr. Iqbal, who is an expert when it comes to treating your peripheral artery disease. Good morning, Doc. Nice to see you again.
Good morning, Linda. How are you?
I'm very good, thank you. Tell us what exactly is peripheral artery disease?
Peripheral arterial disease is the growth of plaque within the blood vessels, which eventually will grow and cause blockage.
I understand diabetics might be, be seeing this in their life, and others as well.
Indeed. People with diabetes are actually about 300% more prone to getting these blockages.
Doctor, what might be the symptoms? How would somebody know they're starting to suffer from this?
Unfortunately, since we have so much of collateral flow, it's a silent disease, and you don't know until about 85 to 90% of the blood vessels are blocked, and generally starts off as cramping, especially when we are walking or going up the steps. People may start to feel cramps in their calves, which move up to their thighs. And if left untreated, they might get non-healing ulcers on their toes, which can turn into gangrene, and eventually some of these patients may require amputations just for infection control.
My goodness. Dr. Iqbal, why should people choose Buffalo Vascular Care?
It's nice that you ask us. Buffalo Vascular Care is a facility where it's an all-inclusive facility where we have an accredited vascular lab, and we also have an accredited cath lab. So we can see patients here, work them up, and treat them here outside the hospital. The equipment, etc., which are needed to treat these conditions are all available here.
Doctor, if somebody comes in for treatment like this, how long is that procedure?
The procedure could be anywhere from an hour to 2 to 3 hours. We take our time, we do whatever has to be done.
Yeah.
And it's done with local anesthesia and a little bit of conscious sedation, so there's no general anesthesia and the associated risks.
Doctor, for people to come see you, do they need to be referred from their primary care doctor, or can they call you directly?
They can call us directly for sure, but most insurance companies do require a referral from the primary care.
And what is recovery from something like this?
In general, people will come in, have their procedure, and leave, and they will walk out in 2 to 4 hours, and the blood flow restoration is immediate.
Amazing.
And the only thing we require is no heavy lifting for about 3 days.
And doctor, it's really important for people, if they start to notice these symptoms, to come in and not ignore it, because that could really lead to some problems down the road.
Indeed. It could lead to amputations. So that's why we tell our patients, especially who are diabetics, to control their diabetes, and smokers to not smoke.
Definitely. Doctor, would people have to come in periodically after that to be checked for this again?
We generally like to keep an eye on them, so depending on the severity of the disease, we may ask them to come back in 3 months, 6 months, or a year.
Yeah, but especially if you're diabetic, be watching for those symptoms.
Indeed. Yeah. Any small new blisters on the toes, anytime that there's non-healing ulcers, that's the time that they must seek treatment. And also very important for diabetics is to have the right comfortable shoes, because diabetes causes neuropathy. They may not feel the uneven rough surfaces or anything sharp that they might be stepping on.
Well, you're hearing from an expert. This is what Dr. Iqbal does, and we're so fortunate to have Buffalo Vascular Care. They specialize in this. So by all means, if you're starting to notice symptoms or you believe you should come in and talk to the doctor, by all means, give them a call or log on. Buffalo Vascular Care. Dr. Iqbal will see you, and by all means, you'll want to do this sooner rather than later to take care of your peripheral artery disease. And you heard doctors say one of the first symptoms is cramping. So if you notice that all of a sudden you're getting more cramps in your legs, that could be a sign of this, especially if you are diabetic. Do not let this go. It's very serious. By all means, call them at Buffalo Vascular Care, 6337 Transit Road in Lancaster. Give them a call at 852-1977 or log on to viabuff.com.